Well, welcome everyone. Thank you so much for joining us for our introduction to youth peer support. This is just a little bit of an overview of the youth peer support service here in Michigan and how to partner with youth peer support specialists.
Thank you, Sarah, and thank you everyone for joining our webinar today. My name is Christy Dristy, and I'm the Program Manager for Youth Peer Support and Parent Support Partner with ACMH. And I am excited for our discussion today about youth peer support. As a former youth with my own lived experience with mental health, this is something that I'm always particularly passionate about sharing with others and talking about how youth peer can enhance youth voice and youth's confidence as they navigate their mental health experience.
And I'm Sarah Reynolds. I am the Youth Peer Support Statewide Coordinator. We both work at ACMH, and everyone at ACMH has their own lived experience as a youth or a young adult with mental health experiences or raising a child with mental health experiences. And so all that we do really is related to youth and family voice. And this is another facet of that work. And so having my own lived experience as well, it's something that I care deeply about, and I'm so excited to be a part of this project. And I hope to be able to share just how powerful the work is with you all today.
Thank you, Sarah. All right, so to get us started, here are some commonly used acronyms that you will see show up in our conversation today. MDHHS stands for the Michigan Department of Health and Human Services, and we'll talk more about their role and the partnership that we have with them here at ACMH. And ACMH stands for the Association for Children's Mental Health. And as Sarah said, we are the statewide family organization, which I'll talk a bit more about our role and the role we play with YPS. So when we say YPS, we are talking about the Youth Peer Support Service that is being delivered. And when we say YPSS, we are talking about the Youth Peer Support Specialist, who is the service provider. CMHSP stands for Community Mental Health Service Provider, which would be the Community Mental Health Organization or a contract provider that is providing the YPS service to youth and young adults, which is Y/YA. And we will talk much more in depth about who can receive the service, what are the qualifications to provide the service, and what the service looks like. So just to talk a little bit about the history of youth peer support in Michigan, here in our state, we have a very robust history of peer support services for adults and for parents. So before YPS came on the scene, there was Parent Support Partner, which we also house and deliver training for here at ACMH. But through this evolution of peer support, it was clear that there was a need for youth and young adults to also have support from someone who gets it, from someone who understands the feelings associated with being a young person who's struggling with mental health. So, we know the importance of having that peer support being part of the service array. So we wanted that to be available to youth as well. So in the development phases, ACMH and MDHHS partnered with a national consultant to get feedback from various stakeholders in an effort to ensure that youth and family voice was really driving the development of this whole model. So it was important that youth and families and stakeholders who had experience in this work to be able to talk together about what is needed for youth. What would this service look like? What would the curriculum look like? What kind of training would young adults with mental health experience need to be successful in providing this peer support service within the CMH kind of provider world, which is often a really new culture for young professionals with lived experience. So we were very intentional in how we developed this curriculum, and we're really proud of it. At this point, it's very well established. However, we're always looking for feedback for various enhancements and tweaks so that we can ensure that this service is truly and authentically driven by the needs of youth and families in our state. So, we've talked a lot about ACMH and MDHHS. So we wanted to give you a better idea of what this partnership looks like and who we as the statewide family organization are. What do we do? So youth peer support and parent support partner is one aspect of the work that we do at ACMH. So when we think about ACMH, we can think of it like a three-legged stool. That's a visual that we'll often use to describe our work. And so one of the legs is YPS and PSP, the Medicaid service that we've been talking about. And the other two facets of the work that we do are advocacy and training and education and support to youth and their families. And so all of those pieces together allow us as the family org to support youth and family voice in the services and supports that they receive, and to be empowered decision makers in policies, and to have a voice in their services and in their communities. So it's overcoming stigma, it's raising awareness, it's ensuring that youth and families are at the table, and not only at the table, but that they're empowered with the skills and the ability and the confidence to speak up in a meaningful way. And so, as Sarah said before, everyone at our organization has their own lived experience, either as a parent raising a child with mental health, or as a young adult who had experience as a youth receiving mental health services. So that is the lifeblood of the work that we do. I call lived experience our superpowers. Like, that's what allows us to do the work that we do, but also, you know, in how we oversee these trainings for youth peer support and conduct the technical assistance for these services, because our feelings and our experience and that intimate knowledge that we have informs that perspective. And so that's really what ACMH brings to the table with this partnership. And MDHHS, we're very fortunate to have a close working relationship and partnership with them at the department, because they have expertise in the Medicaid aspects of these services. They provide direction around the more technical aspects when it comes to billing and codes and things of that nature. And so it's both and, it's not either or, and we get the pleasure of working with them on a very regular basis, and we're able to have conversations about what these services need and how we can best support youth peer support specialists and their supervisors to provide this service to fidelity. And so we know that systems are complex and that this work can have challenges. And so we have developed a very extensive kind of training model that includes ongoing coaching for youth peer support specialists and their supervisors. And so Sarah's going to talk with us much more about what that looks like here at the end of the presentation. And we're so fortunate to have Sarah, because she helps us create these very cool graphics, because much of this, it's difficult to sometimes put to words. So having a visual tool of how we all work together in the delivery of these services and how we all share in the expertise within providing YPSS to youth and families, it's really helpful to have a visual tool like this. So This kind of represents the partnership that MDHHS and we have here at ACMH with them. That partnership that I was describing in our last slide. And it also shows a bit more in depth how we support the YPSS and their supervisors. And, you know, as you can see, this is a multi-directional partnership and kind of relationship that we have at every level. So we are providing guidance, coaching, training, and technical assistance to the providers of these services. And they are providing us feedback and information around lessons learned that they have, challenges and successes that they've had with the services. So it's a continual feedback loop that we have to ensure that we are providing a very high quality service to youth and families in our public mental health system. Okay, so family-driven, youth-guided. We can't really fully have a conversation about youth peer support without talking about family-driven, youth-guided, because this is the philosophy that drives the work of youth peer support. This is kind of the spirit of what we do with YPS. And it touches on so many of the aspects of empowering youth and families within the mental health arena, but also, you know, in the world, in all child and family serving systems. So it's a belief system. It's knowing that parents and youth have a right to have a decision-making voice in any, we always say nothing about us without us. So any kind of policy that would impact youth and families, or services that they receive, or legislation that would impact youth and families, we know that that voice needs to be represented, and youth and families need to deeply believe that their voice matters and that it is valued, and that they can trust that they are an equal partner at the table. So it's not saying kind of, again, either or, it is both and. So it is that fundamental piece of partnership that youth and families know what is best for them in their family culture, and clinicians have their experience and area of expertise that they bring. And, you know, all providers have an area of expertise that is needed kind of in this circle of support. And so it's knowing that we can all work together, and that it is incredibly important that youth and family voice is a part of those conversations. And I'm going to talk here in a minute about, I always say at every level, so I'm going to break that down here in a minute with a visual tool. So, you know, how does YPS fit in with this? So youth peer support is one piece of how we can support this family-driven, youth-guided philosophy within mental health services. So again, I'm going to show this visual tool here, which I think will be helpful. But YPS is kind of, in a way, a micro level sort of support, because it's supporting youth voice within their treatment plans and within their plan of service, and it empowers them to speak up with other providers involved in their care. So it's kind of that one-on-one sort of support in that way. But it's also a service that, in having it within our public mental health system, it creates the opportunity for people with lived experience to be employed within the community mental health agency, to bring their perspective of lived experience to staff meetings and to, you know, conversations, informal conversations. And we'll talk about leadership here, you know, even at the board of directors level. So it's really important that all of these levels that youth and family voice, that there's an opportunity for this family-driven, youth-guided approach to be being represented. And so this kind of shares some of the levels that I was just describing. And when we look at the child and family level, we're thinking about how we are empowering youth and families. And when we think of YPS, specifically youth, to be able to identify goals that are meaningful to them, to be able to have a voice in their plan of service, to be able to receive services in a way that is meaningful and that meets the needs of, not only the youth, but also the family. It helps for youth and families to have ownership over this whole process. And sometimes we think about shifting the dynamic from doing to doing with. And I love that kind of, the thought of that shift. I think that's very powerful. And so family-driven youth-guided also exists at the programmatic level. And so in a way, this is also where youth peer support comes in, because this is having youth and parent peers employed at the CMH or the contract agency. So we have those positions available and there's funding for those positions. And not only that, so it's not only a butt in the seat, having a person in the position, it's having this whole certification model that that ACMH and MDHHS provide, and it's the CMH ensuring that the youth peer support specialist is completing that training so that they are empowered to do this work, and that they are comfortable partnering with clinicians, and that they know that their experience, their expertise, that is equally as valuable as the clinician sitting at the table. So it really promotes that partnership and honors the perspectives that we all bring to this work in serving youth and families. Also at the systems level, I'm passionate about this piece because I think it speaks to the growth that, like, in doing and having this kind of approach and investing in youth and families, we have leaders who emerge and who are sitting on the board of directors and who are advising policy and legislation. I think that is incredibly impactful. And, I really think that's very cool for youth and families who are sort of just starting on their journey and are sometimes looking to feel that hope when things are tough, that they can see that, building these skills can really culminate in something wonderful. And so that's incredibly, I think, powerful to think about. Okay, so we have another visual here, and this might be our new staff favorite, so we're excited to share it with everybody. But we wanted to have a tool that represented how all of these pieces that we're talking about today really fit in. And we thought of it like a garden. And so the family movement, which I just very briefly kind of brushed across earlier, the family movement is what laid the groundwork, quite literally in this example, laid the groundwork for all of these services and supports to be available to youth and families that are family-driven, youth-guided. And so we will often talk about the Federation of Families, which is the national family org that really pioneered this work. And that was a very grassroots effort. Many puns here, but there's a very grassroots effort with parents who were saying, we need to have a say, and we're going to do what it takes to make sure that parents and youth have that representation and have a platform to share their voice with decision makers. So, here at ACMH, we would fit within the youth and family movement piece here. And then we can think of family-driven, youth-guided as sort of the fertilizer. This is kind of what's giving us richness to the soil. It's that heart of the work that we talked about. You know, we need that richness to be able to do and develop some of the other services and supports that we're, you know, and YPS being one of those. And so we have our watering can here, which is funding sources. So I talked about how Medicaid funds youth peer support and parent support partner too. And that's one funding source, but there are other funding sources that support other areas of work that promote family and youth engagement and family and youth voice opportunities and awareness activities. So there are many different funding sources that help kind of clarify here, as you can see, some of the flowers that we have in our garden and help support that work. And so we thought that this was a good example and kind of visual representation, because there are many different flowers. These are just some, but it's like the YPS service. Sometimes what we can see is that we'll talk about things kind of getting thrown in the youth bucket or the parent bucket, and it'll feel like, okay, you know, if it has to do with youth and parents, then it's just kind of gonna all come under this Medicaid service. And so, you know, that any activity related to parent voice or involvement and youth voice or involvement would fit within that Medicaid service. And really that's actually backwards, because as you can see here with this garden, YPS is just one flower. It's a mighty flower and it's an important one. But we need all of these pieces to have a garden. And so advisory councils, advocacy work, when we're thinking about panels where youth are sharing their experience, and when we're thinking about youth and family forums or presentations that they might be doing, those are all pieces in the garden, but they don't come under this YPS flower. And Sarah's going to help us understand really what that looks like a bit more in depth as I turn it over to her here in a moment. And so we had to put in some weeds because, you know, we talk about these things and we're really excited about them. And we know that it isn't all sunshine and rainbows. I always say in systems change work, if it's always easy breezy, then we may not be doing it right, because systems change is hard and it takes time, and that's okay. So we put some weeds in here with possible role confusion, possible stigma, you know, whether that's internalized stigma that we have as individuals with lived experience, or stigma that we might feel from the outside. And, you know, role confusion, I think we'll kind of come to understand that a bit more here as the presentation unfolds. But we just want to normalize those pieces as it's all part of the journey. So as long as we're kind of coming together as partners in this work and seeking understanding ongoingly from one another, then we can have this beautiful garden that we're all kind of creating together. And so I'm going to hand it back to Sarah, and she's going to talk with us a bit more about YPS.
Thank you. So yeah, now that we kind of have an understanding of the garden in which YPS grew, I want to talk a little bit more about the nitty-gritty details. So youth peer support is a Medicaid state plan service for youth and young adults with serious emotional disturbance or serious mental illness. Is provided by a young professional that has lived experience receiving mental health services as a youth. And so everyone that comes through training, everyone that provides the service, they have their own lived experience with mental health as a youth, a young person, and knows what that experience is like. The youth peer support specialists are also younger in age. And so they're adults up to the age 18 to 28 is the age group. And so being that close in age really allows for the professionals to have that peerness and connection with the youth that they're working with through both age and lived experience. The service is written into the individualized plan of service with the youth's input, youth and family input. And then, yeah, goals and activities are mutually identified in active collaboration with the youth receiving services. And the youth peer support specialist can be hugely helpful in helping the youth kind of figure out like what goals and activities they want to focus on and being able to communicate that with their providers and their team. And so I think that that's going to be kind of a pivotal piece that we talk about when we get into the partnership piece, but one that I wanted to highlight here. And then interventions are provided in the home and community. We really wanted for youth peer support specialists to be able to meet youth where they're at in the home and community. And so make it more accessible for folks and really kind of meeting their needs as best as possible. Okay, so who can receive youth peer support? We talked about this a little bit. It is for youth with either serious emotional disturbance or young adults with serious mental illness, and it's through the community mental health system. It's intended for youth and young adults who are middle school to high school age. We don't really have a bottom age group. It depends on level of kind of ability to understand the unique relationship and the needs of the youth or young adult to kind of determine like what that looks like, but it caps out at age 26. I think it's through 26 and so no longer able to receive the service once they hit the age of 27. And so it's really based on the individual's developmental and life stage needs. A lot of the work that the youth peer support specialist does is creating connection through lived experience and being able to truly be peers with one another and talk about some of the things that maybe you don't really feel comfortable talking about with your other support people because maybe you're afraid of judgment, maybe you're, dealing with some internalized stigma. And so the youth peer support specialist can kind of just sit there with you and be in that moment with you and say, hey, I get it. I know what that's like. Even if maybe I wasn't in the exact same situation, like I understand those feelings and I want to be able to support you to communicate those feelings with your treatment team, if it's, applicable to your treatment or other support people in your life. And then knowing that youth and young adults are oftentimes going to be involved in the community mental health system, but as well as the juvenile justice system, the child welfare system, and or the education system. And so we really want to provide training to the youth peer support specialists, the providers, so that they have an understanding of those complex systems that youth and young adults may be involved in outside of the CMH and kind of have that understanding of what they may be going through. And then who provides youth peer support? So like I said, youth peer support is provided by someone between the ages of 18 and 28, and they must have lived experience receiving mental health services as a youth or young adult, must be able to identify as someone that has their own lived experience and is willing to share that for the sake of connection. One of the main reasons that the youth peer support specialist is sharing is to provide a sense of hope and understanding and connection. And that's really like the lifeblood of the work. There would be no youth peer support without that element of being able to share and connect in that way. And so that's really an essential piece. Experience receiving services in other complex child serving systems is a plus. And they must be employed through the PIHP or CMHSP system or contract providers. They do go through a training. We have a curriculum where the youth peer support specialist will come through an initial training where we talk a whole lot about what their role looks like, kind of getting to know what they'll be doing on a day-to-day basis with the youth and young adults that they support. And then we have a part 2 training where they get a little bit more acquainted with the different systems that they may be interacting with, or the youth or young adults that they support may be interacting with. And then we have a year-long training process. And so we're touching base with them, multiple times a month. We have a monthly coaching call. We have monthly TA, technical assistance, and that includes the supervisor in that. And then we also have quarterly professional development meetings where the youth peer support specialists from that year will all come together and kind of learn about a topic and be able to share like what's going on in their work. We find that it's very beneficial to take those experiences that they are receiving, like on the job experience, and bring them to trainings and talk through it and hold it in their hands and explore and look at it from various angles and get input from other youth peer support providers. A lot of what we talk about in those initial trainings are very philosophy based. And so being able to take that philosophical piece and plug it into real life experiences is really beneficial for folks. And so we really like to make sure that we're providing lots of hands-on learning experiences as they're getting used to the role and kind of looking at the different boundaries and things like that. So we talk a lot about how peer support is a continuum, and youth peer support is just one way that peer support could look within that continuum. And so it could be, peer support could look like tea and cookies, just hanging out with friends, just, playing video games, like that could be peer support. And then it could also look like, sometimes peer support can look like, doing advocacy for a person. And so we found that like, this is kind of, I think it's kind of a little bit on the in-between, where it's like you're supporting someone and getting to know them, on a personal level, and you're sharing about yourself, and you're really empowering them to kind of feel that they can speak up and that they can have a voice and advocate for themselves. And so we do acknowledge that many types of peer support can exist, but this is what this one looks specifically. And so we have quite specific boundaries around the role and how you can provide the service. And so that's where all that training really does come into play. As Chrissy shared, youth and family voice really is at the core of the philosophy, using real experiences to shape the service and its intention. And it's not a duplication of other services available to youth and families. I think, sometimes, as Chrissy said, like with the youth bucket, like you may think, well, this is a youth service, so they can kind of do anything with this youth. And we want to make sure that we really outline like what this is going to look like specifically, so that we're making sure that we're being intentional in the way that the service is provided. And it's really the focus is on that authentic connection, that lived experience, that support, walking with someone and supporting them to feel empowered to advocate for themselves. And so we have a video here.
This video shows the power of lived experience and connection through the youth peer support perspective. The youth in the video is a real youth, and the YPSS is a real YPSS. And so we wanted to show this to you all, just to show just how important this work really can be for the youth that receive the service, and how strong of a connection the YPSS builds with the youth and young adults that they serve.
I get angry a little easy if people don't listen to me. If I'm trying to tell them something important, right, and they just don't listen to me, they think I'm lying. That gets me mad. Basically, you don't listen, I get mad.
I've had Jacob since our parents passed, since he was about 8. Jacob's had a lot of behavioral issues and things of that nature. Not a lot of male role models in the family. So his therapist thought it would be a great idea to try out a program to see if that would help him kind of find himself. That's how we met Jalen. He was introduced so that Jacob could kind of have someone to talk to.
In the very beginning, my very first youth had a pretty rough go of things. Everybody kind of passed him on to the next person. And so when I first met with him, there was that immediate just expecting me to be a temporary fix. And so I really wanted to show him that I was going to be there.
Every time I was looking for every day he came over too. Every day I was looking for, I really didn't have much friends to go out. I can't just go out and make a friend. He's fun. I loved him.
The fact that Jalen had a similar background to Jacob was actually really good. I think he was able to understand where Jacob was coming from and help to direct him a little bit better, especially when he had anger outbursts or was having issues understanding things. Having that level of I've been there and you can pull through and do something with your life and not be labeled was really a good thing for Jacob to see.
I think the youth and their families really benefit from the youth have someone who gets it, being able to kind of empathize, normalize their experience, just their perspective, and seeing change from it, kind of having more options versus, blowing up or just, punching a hole in the wall. They can kind of talk through things.
I think what I do first before I act now. And actually Janet taught me about that. I go somewhere and remove myself from the situation. Even though my sister tells me, my brother tells me to come back, I tell them no, I'm trying to calm down.
I think Jalen did provide a level of hope for him when they worked together. And Jalen was there constantly when he did, was able to come, was there to remind him of like, you can do these things. So, and Jacob would try. I think that he worked out really well.
The time I was in like some really angry one time, he tells me to go out. I went with him one time. We walked and we talked. Basically, I felt some hope inside of me saying, I believe I can do this now. I believe I can push through stuff. If I get in a tough situation, I can go through it with help. He said one time, it's been a while, that he was like me, kind of like autism, I think, right? And he was like the same situation basically as me. So I was kind of relating. Till the first time I didn't believe him, but until he started talking about it more, then he started to sound just like me.
Yeah, how did that make you feel?
I didn't feel alone no more.
Now we're going to talk a little bit more about the role looks like specifically. So youth peer support specialists provide youth with empowerment and hope through direct support, information sharing, and skill building. And these are written into the Medicaid language, but they may look a little bit different from what you expect. So direct support, when we talk about direct support, it's really that connection through lived experience, walking with, talking about some of those experiences that you have, like with mental health, that maybe you don't feel comfortable talking about, or you are not sure if maybe someone would judge you for that experience. And so being able to talk with someone and kind of try it on and see how it feels to kind of talk about some of those really difficult pieces of your journey with someone that gets it and has been there, and there's that connection of understanding. I think that's really important. And that's not to say that, the youth don't trust their other service providers. But I just remember like reflecting back on my own lived experience and like thinking about times where I felt shame for not being able to care for myself in the way that my therapist had, kind of encouraged me to do. Or, I felt shame for not feeling normal and not feeling like I could just do what I was supposed to do to take care of myself. And so some of those experiences, you may not even realize that you're feeling shame about it. And then when you talk about it and you are able to have someone kind of validate where you're coming from and saying like, yeah, like I totally get that. I've been there. And it's nothing to be ashamed about. It's like a huge relief. And so maybe then you feel a little bit more comfortable with thinking about, well, my therapist provided me with a coping skill to use, and I haven't used it because fill in the blank, my mental health symptoms got in the way. But now that I've talked about that with my youth peer support specialist, maybe I'm feeling a little bit more comfortable talking about that. And maybe I can talk with my therapist about what would work a little bit better for me, or what are some of my barriers that I have meeting this goal I have. So just things like that, I think are really important and helpful. And that kind of goes into the skill building piece as well. A lot of the skill building is around self-advocacy and system navigation, supporting the youth to be able to navigate for themselves, kind of taking that step back as the provider and letting them find their own way, knowing that they have someone to walk beside them and support them in a really meaningful way, and then sharing information in a way that can be understood. So really just thinking about, how you can strategically share your story with someone to make the most impact, which that's a lot of the training that we do, is around strategic sharing. And so we have a couple of quotes, and these are from real youth that have received youth peer support services. And so the first one we have, it's nice having someone to talk to that's been through it. Jacob S. said that about their service provider, their youth peer support specialist. Someone else said, it's nice to have someone to talk to other than my therapist, and from someone who can say, yeah, I get it. And then our last one is youth peer support has been helpful over the past few weeks. It gives me someone to talk to about my issues and can relate to what I'm going through. I also really enjoy the activities we do. And so we just wanted to share some real life quotes from youth that have received the services, and to show how powerful it is to have someone that, is close in age and really understands what it's like to walk in their shoes. So we have a question for you. Now that we've talked a little bit about youth peer support services, I'd like for you all to, if you could, in the chat, share any ways that you think that youth peer support services could enrich clinical services, or work alongside clinical services to be most effective. Marcia says support with communication. Absolutely. The youth peer support specialist can be very helpful in allowing the youth or young adult to kind of think about, how do I want to talk with my clinician about whatever it is that I'm dealing with in the moment? How can I talk with my family member about, this is what it's like for me to have mental health. I think that's a really great example. Thank you. Caroline says practice with coping skills. Did you want to answer this one, Chrissy?
Sure. Yeah, this is a really great question. And we talk about this often in training so that the YPSSs are clear that they're not the ones who are practicing coping skills necessarily. They wouldn't be teaching them or, practicing per se. However, they can support the youth that they're working with to identify coping skills that are meaningful to them and to empower them to be able to talk with their clinician about maybe some things that they'd like to explore in their treatment, possibly with their therapist. But as individuals with lived experience in this role, our role is always going to be to strategically share and connect around the experience, maybe sharing, I remember what it was like for me when I was struggling to find coping skills that were going to work for me. Or I remember when I found some skills that really helped me in my journey and how important that was, for me to feel hope. And encourage them to be able to have that conversation with their therapist if, when, and how they're ready to do that. But we really want to kind of stay within our lane and provide support in our role in this way and build the bridge to the therapist who may be working on some more of those concrete practicing of the skills.
Yeah, absolutely. And so Amy answered and said, help to gather resources, which I think similarly, the youth peer support role, you can absolutely support a youth in gathering resources, but again, you're not going to want to do four. You'll want to kind of support them in figuring out what that process looks for them. Or looks like for them, and talking about some of the challenges. I just remember And still today, sometimes it's so hard for me to make a call. Like my anxiety really starts kicking in when it's like, I know I'm going to have to advocate for myself. And so talking about how, your mental health challenges or the things that you're going through in life could potentially add barriers, and like what that's like, really having some conversation about that to normalize and validate them, and to support them in feeling that internal empowerment and ability to do for themselves when the youth peer support specialist is, no longer around. We talk with the youth peer support specialist about like working yourself out of a job. And so you're supporting the youth and young adults to build these self-advocacy skills. So then when they're out of services, when they become an adult and they're, no longer even eligible for youth peer support services, they will have that under their tool belt. Like, I went through a really hard time, like trying to figure out how to advocate for myself. And I learned a lot of lessons in that process, and it makes it so much easier. Well, maybe not easier, but it makes it feel like you're not out in the cold when you have someone that gets it and is walking beside you in that journey. Any other thoughts on how you think youth peer support services could enrich clinical services?
Yeah, I see Andy says normalize experiences with mental health. And absolutely, I think this is such a foundational piece of the work that a YPSS can do, and letting youth know they're not alone. For me, I felt like I was an alien in my own body for a lot of my life. Like it seemed like I would always compare my insides to everyone else's outsides, and everyone's got it figured out, and they can do this thing called life, and I'm feeling like a black sheep who has no control over my behavior, that I'm kind of doing things wrong, and feeling so much shame around that. And so youth peer support specialists can let youth know, like, you're not alone and you're not a bad kid, that you might feel like sometimes. And, I'm here to support you. And those are things that, I felt a lot when I was a young person. And, I want you to know there's hope. So normalizing mental health experiences is absolutely key.
Yeah, and then I see Jennifer says how they navigate supports. And yeah, like I think a YPSS can be really helpful in supporting youth to build bridges with other support people in their life. I think it kind of goes along with that working yourself out of a job piece. Being able to create a network of supports for yourself is so important. And again, it's really kind of taking that step back and allowing them to do for themselves, knowing that you're going to be showing up weekly and touching base with them, and really encouraging and empowering them through the conversations that you have, through that normalization. And then, as Kelly says down here, validation, validating them through the process. I think that goes such a long way with really letting the youth or young adult know, like, I'm not alone in this. I just think, having mental health, especially when you're a young person and you're thinking about, moving into adulthood and what that's going to look like, it's so isolating and can be so scary for folks. And so just having someone that says, like, hey, I'm with you through this, like, there's going to be a lot of ups and downs, but I'm here and I've done it before, and I might be still a little bit in it too, and so we're going to be working on this together, and I'll be supporting you through this. So yeah, any others? Okay, awesome. Well, thank you guys for your thoughts. Our next piece is just partnering with youth peer supports and how we can do this together to be able to best support the youth and young adults. So as Chrissy said, everyone has their own experience and expertise. And so really understanding and honoring those differences between your role and the youth peer support specialist role and the role of the youth or the family, that's a real key to partnering with the youth peer support specialists. Because youth peer support is so unique and really based on that lived experience and connection. youth peer support really is not a duplication of other services. You may be able to go to the park and shoot hoops or take a walk around the neighborhood and talk about some of the things that the youth wants to talk about, but really at the center of those conversations is going to be that connection and lived experience and sense of hope and understanding and empowerment. And so we really want to avoid duplicating other services and really focusing on what makes youth peer support so unique and so valuable to the youth and young adults that they'll be working with. So regular communication about the role and support provided to the youth peer or youth or young adult is really a key component to successfully partnering with youth peer support specialists. Like we said, the service is a little bit different from other services that are currently available. And so just having that regular communication about this is what I can do to support, this is what my role looks like in this situation. I think that can be really helpful in kind of divvying up like, what expertise are we using and how can we work together to best support the youth or young adult? And then one really great component of this all is youth peer support specialists are really able to empower the youth or young adult to effectively communicate with service providers and other supports. And so I think that's such an important piece to all of this is being able to communicate their needs and preferences and challenges and barriers with the folks that are there to support them. And so hopefully with improved communication or more effective communication, the service provider is going to be able to better understand those needs. And sometimes from conversations that you have with a peer, you may kind of come to realizations that you just didn't even think of on your own. And so just that connection and understanding and willingness to kind of explore like what your journey looks like with someone who is very open about their own lived experience and their own journey and the difficulties that come with it. It kind of allows the youth or young adult to be able to kind of explore themselves a little bit and be able to then communicate that with the service providers and get the most out of their services, really be able to drive that time that they have with their service providers. And then once again, we talked about this before, but empowerment rather than help. So, when we think of helping, we kind of think of doing for or stepping in or advocating for. And so that's really outside of the YPS role. The YPSS would more than likely support the youth to be able to do some of those things. Or if the youth doesn't feel like they're able to, maybe seek out someone that is an expert in whatever it is. So, kind of learning from another professional maybe, or a support person on like a natural support on how to get their needs met. Okay, so we have time now for question and answer. So if anyone has any questions, we would love to answer them. You can just type it into the chat and we will take as many as we can. All right, so Marcia says, can a youth peer support specialist be part of a wraparound team? And so youth peer support specialists, they can absolutely support youth that are involved in wraparound. The youth would be a little bit more hands-off, maybe not attending meetings so much as supporting the youth to prepare for meetings and debrief after meetings, being able to kind of communicate with their wraparound team about what they want and need, if they're having any barriers that maybe their services need to be adjusted a little bit, but they wouldn't be a part of the built-in team. So youth peer support would kind of be on the outside of that, but still able to communicate with the team.
And it looks like Robert asked, who makes a good referral? And it's important that first and foremost, the YPS service is available only to youth who are receiving services within the public mental health system through their local community mental health agency. And they need to meet the criteria to receive the service that Sarah described earlier in the presentation. And I think most especially one point that we like to hammer home besides some of those logistical kind of components is this youth interested in the service? Like, is this something that they want? We have seen far better engagement and, you know, youth kind of being able to get the most out of the service when it's something that they've decided that they would like for themselves. So it's very important. We've seen for the youth peer support specialist to often be the person who introduces the service and meets the youth and talks with them about the benefits and, you know, how they partner with the youth and how they, you know, the role that they play on the whole treatment team. That message is often better heard, and it's just, you know, youth are a bit more excited about those pieces when they're able to have that conversation with the YPSS directly early on. I think that the youth peer support specialist can just speak to the work that they do in a really intimate way. And also, you know, the youth gets to connect with another young adult kind of right off the bat. And I think that that's incredibly powerful for youth to have that firsthand experience in that way. And one other piece to remember is that YPS is available to youth with SED and to young adults with SMI. It is not currently available for youth with IDD. So that is another question that we do get a lot, and it's important to consider that when making a referral.
Next one we have is from Caroline. It says, is there any data for this service? And right now we are piloting a survey with a couple of different communities, but we don't have any data to share, but it is on the way. So we'll be sharing that when it comes out.
And what kinds of activities would the YPS do in the community with youth? Create a resume or enroll for classes? This is a great question that comes up often as well. And so I go back to what Sarah talked about earlier, which is that youth peer support, first off, the goals need to be included in the mental health plan of service. So the point of the connection and lived experience that the YPS has with the youth is really around the feelings that come with their mental health experience. So, you know, sometimes a common misconception can be like asking the youth peer support specialist, like, hey, can you show the youth how to do this resume because you've had a lot of success in that area? And that very well may be true, but the intentional piece and the emphasis within this role is around your mental health journey and finding your voice in that. So again, it's that internal empowerment rather than kind of showing a youth how to do some more of these kind of concrete, tangible sort of tasks that might be more, it's kind of maybe transition age youth specific sort of pieces that they might be working toward. So the youth peer support specialist can relate to what those feelings and experiences might be like for a youth. You know, maybe what are some of the unique barriers, like as a youth with depression, for example, or when you're having anxiety about doing these kinds of things. And you know, they can empower them in that way to know that they're not alone and that, you know, these things are totally doable for youth with mental health, but we wouldn't be kind of checking off the to-do list with getting some of those things accomplished.
Yeah, and I think too, like the youth peer support specialist can support the youth or young adult to like ask a family member or another support person in their life, and that could potentially build more of a connection with that person, which I think is really important. And then the next question that we have is, when is a good time to transition out of YPS or PSP support? And so really a lot of it is based on like, if the youth or family, if it's PSP, is feeling like they have accomplished all that they can with the person that they're working with, you know, we talk a lot about family driven, youth guided. And so that does play a huge component in the work that they do. But also like it's, thinking about the activities and the goals that they're working on, thinking about like, is this person able to advocate for themselves? Are they feeling empowered? If you're like saying yes to all of these questions, like it may be good to check in with that person and say, hey, like, you're doing fantastic. Like we've made a lot of progress with you speaking up, and you seem like you feel very empowered, and like you are using your natural supports to kind of get your needs met, and whatever that may look like for that particular youth. What do you think about, youth peer support services? Do you think like you're ready to move on, and kind of touching base with them and having that conversation? I think that's a really great way to go about it. And making sure that they have input, because once again, like this service really is driven by the youth's wants and needs, with the family being a part of that conversation as well. And so we really want to kind of value and honor their perspective on like what they need and what services work for them, and what they hope to accomplish. Any other questions? All right. Well, thank you all so much for joining us today. We have contact information here for Chrissy and Justin Tate. He is our primary contact and partner at Michigan Department of Health and Human Services. And he's kind of our go-to person when we have questions about Medicaid. So we have both of their contact info up here. And we just really appreciate you joining us today. I hope that you learned a lot, and we are always here for any questions that you may have. So thank you.